Good evening. Health unions estimate around 20,000 NHS staff in the region joined today's national strike. The 4-hour walkout by nurses, midwives, paramedics and others was in protest over pay. But it meant disruption and delays for some patients. Giles Latcham reports.
Defiant in the drizzle, Black Country health workers won the sympathy vote from motorists passing Russell Hall Hospital. Striking for the first time, Rebecca, a nurse for more than 20 years.
The public are really behind us by the looks of it. They're popping their horns every 2 minutes. It's been great.
A mother of two from King Swinford, she earns £24,000 a year and she thinks she's worth more.
We're not being valued as nurses. We deserve a pay rise. We're working hard. We're doing a job that so many other people don't want to go out there and do. And we're doing it. And we should be paid fairly for that.
At daybreak, staff walked out at the region's busiest maternity hospital, Birmingham Women's. Among them, midwives, a profession on strike for the first time in 133 years.
We're asking for a 1% pay rise. MPs have awarded themselves 10%. The government can afford it, and what we're asking for them is to come back to the table.
It's simply not true when the government say that there isn't any money. There's over £1 billion unspent in this financial year, and this 1% pay rise would only cost them £300 million.
About 150 ambulance workers walked out. Growing numbers of paramedics are abandoning the career, but those who remain don't take strike action lightly.
It's been a very hard decision. We have to think quite hard. We've gone against our morals, really. But we're not standing up against West Midlands Ambulance Service. We're standing up against the government to get the fair pay that we think we deserve.
Despite public appeals, there was no dip in 999 calls, and in many cases, response times were longer.
Our staff work very hard, and we do have sympathy with them. We've worked closely with the unions so as we can protect those 999 calls that require an ambulance response.
The Chief Executive of the West Midlands Ambulance Trust has written to the Health Secretary, Jeremy Hunt, on behalf of other senior ambulance managers, calling on him to begin negotiations with the unions. Their service is highly valued by many. What value, though, to place on those who perform them? Giles Latcham, BBC Midlands Today, Birmingham.
Well, with me now is our health correspondent, Michele Paduano. So we've heard from the unions that 20,000 people took action today. Do we know what kind of impact it's had on patients?
Yes, well, the biggest impact was with the ambulance service. And at times today, the most life-threatening calls, the levels fell to around 60%, when it should be around about 75%. We heard that about a third of all paramedics went out on strike. And I understand that this afternoon, those numbers weren't coming up too much as they tried to clear the backlog, so still very, very low and very serious. Elsewhere in the health service, it was more symbolic. In terms of hospitals, we understand that 51 planned operations were cancelled. These were mainly in the urban heartlands of Birmingham, Sandwell, Worsfold and Stoke-on-Trent, although we never got figures for Wolverhampton. But from that point of view, it was more of a disappointing strike.
How have we managed to get to this point?
Well, the independent pay review body set a level of 1% cost of living pay rise for everyone. Now, the government said that this should actually be paid as really a one-off bonus and wouldn't be pensionable. Then on top of that, staff that are still in training get a 3% increase each year, depending on the skills that they take on. Those people will not get the 1% pay rise either. The government says they can't afford it because of austerity. The unions say we still have one of the cheapest health services in the world.
OK, Michele, thanks for that update. Well, the government has described the union pay demands as unaffordable and warned that they could actually lead to job losses. Well, Paul Uppell is the Conservative MP for Wolverhampton South West and a member of the Downing Street Policy Board. Mr Uppell, NHS workers are saving lives. Don't they deserve a pay increase?
Well, Amy, in your piece there, you referred to the Women's Hospital in Birmingham. All three of my children were born in that hospital, so everybody's incredibly appreciative of the work that's done here. And if the money was there, this would be the first port of call, because the work that's done in the NHS is absolutely invaluable, and we really do appreciate it. But on top of that, Amy, if we want a health service which is fantastic and applicable for the 21st century, we have to have sound economic finances. And ultimately, these are tough choices, long-term choices, but the right choices in the long term.
But we've seen the public sector have a pay freeze for 4 years now. At the same time, MPs are experiencing a 10% pay rise. I mean, it just smacks of double standards, doesn't it?
Well, Amy, the pay rise is for 2015, so that's something that's recommended after the next general election. One thing I've always argued about, and it's probably one of the first things I said when I became an MP in 2010, is that if we as politicians are going to connect with ordinary voters out there, we have to actually reduce the cost of politics. One thing I'm really in favour of is reducing the number of MPs and also reducing the numbers in the House of Lords. We have to have a more effective system to make sure that we connect with everybody out there.
Mr. Well, thanks very much for joining us tonight. It's good to have you with us this evening. Coming up later in the programme.